have a wonderful team behind you.
Wonderful
A wonderful
team.
support team.
Okay, this is you guys.
All right, thank you. Hi, I'm Michelle Spidell, and I'm one of the nurse navigators with the Cancer Center here at Valley View. I've been an oncology nurse down there for a little over 5 years, and I initially became an oncology nurse because of my own encounter with cancer. I'm actually a breast cancer survivor, and it was because of my experience as a patient here at our very own Callaway Young Cancer Center that I was inspired to become a nurse and give back. And now I just love being with cancer patients and working with them and helping them through their treatments. And I'm Kelly. I'm the other nurse navigator. I originally started my nursing career in an inpatient oncology unit, far away from here in North Dakota. And then once I moved here, there wasn't that option. So I did inpatient here at Valley View for 4 years, and then was able to come down and join Michelle in the nurse navigation team. And I've been down here for almost 2 years now. So we're going to talk to you tonight about what happens when you are diagnosed with breast cancer. We first receive a referral from your primary care physician, typically whoever ordered your mammogram and the subsequent biopsy testing. When we get that referral, we do a lot of legwork behind the scenes before we even reach out to you. We want to know as much as we can about your health situation. So we're putting a whole chart together on you that includes your pathology from your biopsy, any imaging that you've had done, your just general health history, demographic information, just as much as we can gather so that when we reach out to you, it's not like we have no clue what's going on with you. We want to really, instill a feeling of confidence that we are aware of what you're going through and we're there to help with what you're dealing with. Also, before we contact you, we work with Dr. Brew's team to pin down a possible surgical consult date. We feel like when we can call you and have something concrete to give you, that gives you a little more comfort too, knowing that there are steps being taken towards your treatment. And then we also think about things that are going to be coming down the line that you're going to need additional imaging, possible genetic testing, and oncology consults, obviously, since we work in the Cancer Center. And Kelly's going to discuss a little bit about that and what you actually discuss or what we discuss with you when we call. So once we get the referral, Michelle does it, we do all that background stuff. And then our goal is to contact the patient within 24 hours of receiving that referral. Just to make sure we're keeping everything timely and patient's not just sitting around going, oh my gosh, like what's the next step? Really reaching out to you as soon as we can, just to get the ball rolling. Things that we discussed during our first phone call is just what your pathology means. Is this an invasive cancer? Is it a more enclosed cancer called in situ? And then there's different receptors that can come with cancers. We go over that. I normally try not to go super in depth because we know that you're super overwhelmed, and we don't want to bombard you with a ton of information, but we want you to know what's going on with this cancer diagnosis. We also discuss kind of what's coming down the line. We go over that appointment time with Dr. Brew, and if it works for you, then we'll help get that set up with Mount Silver's Plastic Surgery, where she works out of. And then we go over kind of the extra things she's going to probably look for. Usually getting a bilateral breast MRI is something, if you haven't had it already, she likes to have, just to make sure, verifying what we've seen with your biopsy, and as well as checking the other breasts, making sure there's nothing suspicious on the other side that maybe wasn't picked up with mammography. We also go over if possibly you might be a candidate for genetic testing. Some people who are really young and come up with a breast cancer diagnosis, we very much want to get genetic testing done to make sure there's no mutations that are possibly making this breast cancer diagnosis pop up. And then we kind of go through what the next after your surgical consult, what it looks like with oncology consults. So generally, to follow your surgical consult is a radiation oncology consult and possibly a medical oncology consult, and just kind of explaining, here's the succession and what we're going with. a couple things I recommend for patients is to like write down questions that you have, leading up to your appointment. Write them down, because I feel like when patients get there, they freeze and they go, no, I don't have any questions, but just making sure they have those questions written down. And another thing we can do is also send an email to you with just credible resources for looking into breast cancer care, and making sure that you're looking into good sites, not going on blogs and going down the rabbit hole of the scary part of the internet. We want you to have information, and information is power, but we want it to be credible. So that's a little summary of what we chat about in our. And like Kelly said, some patients want all the information they can possibly get, and we're happy to help walk you through that. But then others just don't even want to talk about it. And we understand that too, because it can be very overwhelming. So we're there to kind of, be a resource to whatever extent feels comfortable to you. So we're very knowledgeable about everything related to the diagnosis, but we will only provide you with what you really want to hear about and what's useful to you. And throughout treatment, just to kind of give you an idea, once you meet with Dr. Brew, you may or may not meet with oncology before your surgery, but we are still a key point. Once you've started meeting with the other major players in your treatment, we're working behind the scenes to track everything related to your diagnosis and your treatment. We literally have a giant whiteboard in our office where we track our breast cancer patients from beginning to end, because there's so many parts to your treatment, as you can already gather just from listening to us talk and shout out different terms here. But we want to make sure you get your surgical consult, your additional imaging, your medical oncology, radiation oncology consults, genetic testing if that's ordered for you. And then once you've had your surgery, we watch for different things with your pathology from the surgery, because there can be additional testing needed for that. The timing of your oncology treatment following surgery, we want to make sure that once you're done with one step of it, you're getting in with the next provider. So we're there from start to finish, monitoring everything about your treatment so that nothing is missed. We also, just kind of as background to other things we're doing and able to help you with, we're a great point of contact anytime throughout your treatments, whether it's not even related to something in the cancer center. Maybe you had a physical therapy appointment and you can't remember what time it was or who it was with. You can call us. If you don't have the number for, what you're looking into and you don't know who to call, we give you our number from day one, and we are happy to help you track down anything you need, honestly. We just want to be that go-to so that you're never stressed out trying to figure out who to talk to and where to turn. We also offer additional resources with people like our social worker. We have a social worker at the cancer center. We can help you with finances if you're struggling financially to pay for treatment or to pay for traveling to treatment. Radiation treatment can entail daily treatments for several weeks, and that can be hard on people financially, especially with gas prices these days. Or if you're traveling from a long way, if you can't afford to stay in a hotel locally or you don't have someone to stay with locally, we can help you with lodging. We also have other neat resources at the Cancer Center related to breast cancer treatment. One of them is our Paxman cooling cap, and that's a cap that patients can wear on their head during infusions of chemotherapy, and it helps them to not lose their hair. So there's things like that we're thinking about when you come for your consults, that, hey, she might be interested in something like that. So we're trying to think of little things that you might not even think about while you're going through treatment. And then just a little more background about Kelly and I and what we do. Obviously, being nurse navigators in the Cancer Center, we deal with all patients with cancer. So not just the breast team or breast cancer diagnosis patients. We're doing people with colon cancer, prostate cancer, lung cancer. So if you're listening to this and you don't even have breast cancer, but you know someone in your family that has another kind of cancer and they don't know who to turn to or how to get the ball rolling, or we're it, have them call us. we're doing the same behind the scenes things for all the patients as we are for the breast cancer patients. And we care about everybody equally that comes through Callaway Young Cancer Center. So don't ever hesitate to call us or recommend that somebody calls us. I think that was about all we had in our notes. So we are ready to take some questions if anybody has any out there. I hear someone coming with a question.
We've been gathering all the questions in the background over here. We do have a couple good ones. So do I have to meet with oncology before I have surgery?
Okay. So the question was, do I have to meet with oncology before I have surgery? And no, you do not have to meet with oncology. It sounds strange probably to some people, but surgery really is the key part of treatment. And Dr. Brew is just a wealth of knowledge and knows, you know, what your treatment trajectory can look like depending on what surgery you decide to go with. So she's very knowledgeable about the oncology part of things and how treatment might play out after surgery. But we're always happy to set people up with oncology because a lot of people do kind of want to meet their whole team, get a feeling for what kind of treatment they might be in for after surgery and a timeline, get a feel for like how much time things will take and things like that. So you, in most cases, you do not have to meet with them, but there are certain cases where the cancer, you know, maybe it's more aggressive or there are genetic mutations involved where it is important for you to meet with your oncology team ahead of time. So it can be beneficial for sure.
That leads us into someone else's question, which is, what do you mean by genetic testing?
Okay, yep, that's a good one.
And we do have a talk coming up later.
Yeah, Kim Burns, our genetic counselor down at the Cancer Center, I think, yeah, this is right.
Real comprehensive, but maybe if you could just give them a quick.
Right, so
overview.
it's funny because someone told me back when I was diagnosed, and then we'll do genetic testing, and they just kind of rattled it off. I had no clue what they were talking about. So a lot of times, patients, especially younger patients who are diagnosed with breast cancer, it's unusual to be diagnosed at a young age. And then, you know, once the conversation's rolling with your provider, if it turns out you've got family members who've had cancer, whether it's breast or ovarian or prostate, you know, if there's a lot of pieces falling into place that, you know, makes the provider think, wait, there might be some kind of hereditary mutation behind this cancer, they will recommend genetic testing. And so it's basically just looking for some of the top mutations that can lead to cancer. And it's typically done during your surgical consult. It can be something that we actually initiate with you and send out the test to you, but it's typically a spit test, so it's nothing invasive or crazy. It's just a test that looks for traits that show that you have some kind of genetic mutation that probably led to your breast cancer.
Great. And then I think we have two more. What can you talk to the general timeline between diagnosis and surgery and starting chemotherapy or radiation?
So generally, once we get your referral, our goal is to get you in with Dr. Brew within a month. And usually we can do that quite easily. I've honestly really never seen people like over that month date. So we'll get you in with Dr. Brew. She does her surgery consult. And it's about a month or so after that surgery consult. If surgery is the first step, that's when it's scheduled. And then following surgery, if you had a lumpectomy and radiation is needed, our providers down there like to see you about 3 to 4 weeks after surgery. You'll have then had a post-op with Dr. Brew. She says, yep, you're healing well. You know, let's go ahead and go down to surgery, or excuse me, down to radiation. And our Dr. Rossi will see you and say, yeah, we're good to go, get you simulated and start your treatment. And then most of the time after your radiation, which could be varying from a week to 3 to 4 weeks, depending on, you know, what they see with your pathology and everything, you'll go over and meet medical oncology from there. So
Yeah, and I guess I would just add, you know, if it does take a month to get in with the surgeon, we don't want people to panic. I know it sounds like, oh my gosh, I'm waiting so long. In most cases, once your breast cancer diagnosis is found, it's been there a while. It's not like it popped up on Tuesday and they found it on Friday. So if you don't get in for a couple of weeks, it's not a problem. It's not, gonna just mass produce while you're sitting around waiting to get seen. And there are things that we can be doing during that time period to save time so that once you do see the surgeon, they're already done. And like we've mentioned before, that can be genetic testing, that can be getting your breast MRI done. So just look at it as a period of time that we can do other things. We don't have to do it all in a specific order. So don't ever, panic. Of course, if you have a type of cancer that we feel like it is aggressive and it's an urgent situation, we will get you in as soon as possible. You're not going to be waiting a month or anything. But like Kelly said, most people we can get in within 2 weeks. We've had some people that get in 3 days later. So yeah.
Well, the last question is, how do we get in touch with you guys?
So there's a couple different ways to get a hold of us. We have just our office number, which is 970-384-7453. And one of us is there all 5 days of the week. On Wednesdays, we overlap, so you might catch one of either or. If we're not there, you can leave a message. It's a confidential line, so you don't have to worry about, leaving your patient, not leaving your information. We want you to leave your information and your phone number and kind of, what you were being referred for. So we have a little bit of background before we give you a call. If not, obviously we'll call you back and make sure to gather all that information and get you in. Should we give more email? Oh, yes, we also have email. So you can email us at CYCC, which stands for Callaway Cancer Center, nurse navigator at vvh.org. So CYCC nurse navigator at vvh.org. A little bit of a mouthful.
And if you're a provider watching this and you're dying to fax us,
Yeah.
that number is 970-384-7538.
We had one last question come in, and I think it's, it might be a little bit specific. So, we also have people's contact information if you put in an email address for this webinar, and so we can always email this person if it's a little specific, but she says, after radiation, how quickly do you meet with the hormone doctor? Because I'm assuming some people do, maybe some people don't. I was told I need to go on a hormone blocker after radiation. She's kind of wondering if you know the timeline.
So the question was, how quickly, once I finish radiation treatment, do I meet with the doctor regarding hormone therapy? And so that would be meeting with the medical oncologist. They are the ones that manage that. And really, you can meet with them pretty much anytime. We usually set people up, I would say, within 2 to 3 weeks of finishing radiation. I think it's good to get started on that sooner than later. You don't want to wait like 6 months by any means. So I would say go ahead and get that scheduled and within a few weeks of finishing radiation therapy.
Yeah, and generally, once you're done with radiation, the nurse over there in the radiation therapy department will send a referral over to the medical oncology side, and they usually just reach out to you and get that scheduled right off the bat there.
That's part of our tracking that I kind of mentioned, is to like close the loop on everything to make sure once you're done with one part, you get to where you need to go next. And along that train of thought too, we do have a survivorship program where you meet with one of our nurse practitioners when you're done with treatment. You can be on the hormone therapy because that can last several years. But we try to schedule survivorship appointments so people can review everything they've been through and go over like health and lifestyle recommendations going forward. So it's kind of a good closure meeting after you're done with treatment.
Great. So it sounds like if maybe she had treatment somewhere else or moved here or something and she's wondering about getting on, you guys would be the perfect team to contact.
Yeah.
Okay. Well, I think that is it as far as questions. Julie's just checking one last time to see if there's anything else, but thank you guys so much. I think that was really helpful. Again, if any of the participants have more questions, you can send them in. We have your email address, and so we can respond to those through email. Obviously, if you have questions that you think of later, give these ladies a call. And then remember, we have another presentation coming up on the 19th with Dr. Brew, and you'll get a follow-up email after this tomorrow at 6 o'clock. please do go in and either take the survey after today's webinar or from that email that you get and let us know if there are topics that you would like to have us cover, because that's kind of where we get most of our best ideas. But thank you for attending, and thank you ladies for presenting.
Of course, thank you. Thanks, have a good night.
Good night.